obesity is one of the most significant public health burdens. And this is because it's the second leading cause of death in the United States. And if someone has obesity, it's associated with a host of adverse health conditions. So it raises your risk for things like type 2 diabetes, for hypertension, for certain types of cancers, amongst a lot of other bad health conditions. And we're annually in the United States spending about $150 billion on obesity, and that's just indirect medical costs. It doesn't account for the indirect costs like lost productivity. And so current levels of obesity, to underline what you've already heard, it's currently affecting 4 out of 10 adults, and it's 1 out of 2 Black adults, 1 out of 2. Every other Black person in this country is obese. Amongst children, it's almost a quarter of Black children. When we look historically, what we know is that obesity rates have tripled. And so then the question is, well, what's coming? And what this slide is showing you is the projected prevalence of childhood obesity. And so what you're looking at is obesity amongst children who are currently age 2, and it's projecting out those same children's weight when they reach the age of 35. And so take home point number 1 is just look at this trajectory. All of these children are getting bigger. Take home point number 2 is look at this call out box right here on the right. What it's telling you is that for children who are age 2 today, those white children by age 35, 53% of them are expected to be obese. For Black children, age 2 today, 69% of them are expected to be obese by the time they turn 35. Weight is a very predictable thing that we can track and expect what it's going to look like over time. What about adults? And so we just finished a study, which essentially the top line is by 2030, so less than 10 years from now, 1 out of every other adult, so 1 out of 2 adults will be obese, but that there are huge disparities by race. And so if you just focus in on that top right quadrant, what that is showing you is what's going to be the most common BMI or body mass index category in 2030. That dark brown color represents people who have severe obesity, meaning they are carrying around an additional 100 or so pounds. And so that category of severe obesity is going to be the most common category for Black Americans in less than 10 years. And so what about COVID-19 disparities? Dean Brown-Nagin has already underscored the numbers, and this is the snapshot from yesterday. And so, as she said, in the United States, we have over 225,000 deaths. And while COVID is affecting all of us, it is not doing so proportionally. And so just to really underscore this point around race differences, when we look at infection rates, hospitalizations, and death rates, what we know is that if you are Black in this country compared to being white, you're twice as likely to be infected. You're almost 5 times more likely to be hospitalized, and the death rate is twice as high. But the single number I will say that has stuck with me most over the past several months is the one at the bottom right of the screen. And that tells you that if Black Americans died at the same rate as white Americans from COVID-19, more than 21,000 Black Americans would still be alive. 21,000 Black Americans because of that disparity. And so what we also know is COVID-19 has had massive impacts on the economy. And we saw in April of this past year that unemployment had spiked to 15%. That recovery has started to happen. However, the recovery from this job loss is not happening in a total equitable way. And so about 60% of job loss has recovered among whites. Less than 40% has recovered among Blacks, making the economic toll that much harder among both Black and brown populations. So what has really gotten a lot of attention recently is this link between COVID-19 and obesity. And this is what Dr. Strings was talking about. And so if you are someone who both has COVID-19 and you are obese, or you have obesity, you are twice as likely to be hospitalized, and you're 50% more likely to die. So what is driving that? And the honest answer is that we don't entirely know. What we are speculating from the evidence is that if you carry extra weight, then your body may struggle to mount an appropriate immune response to the virus. And as a result, you may poorly also respond to the vaccine. But that is not entirely clear. Here's what we do know. We know, and you heard some of this from Dr. Strings, is that there are these long-standing structural inequities that are underlining why we are seeing higher rates of COVID-19, higher rates of obesity amongst Black and brown populations. So for example, if you are Black, you are more likely to be in an essential industry. That means that you are in nursing or healthcare or in the grocery store setting. And so you're more likely to come in contact with people who are sick with COVID-19. And these essential service jobs tend to be less likely to have health insurance or life insurance. So the chances of getting the care that you need are also muted. What we also know is that there has been a broad understanding, which I would argue has been increasing lately, since the protests around the murder of George Floyd, that structural racism is a common root cause, both for COVID-19 and for obesity. And so we know that if you're a Black American, you have fewer economic and educational opportunities as compared to whites. And that what that does is confer fewer financial resources, which then increase social risks like food insecurity, housing instability, limited access to transportation, and that list sort of goes on and on.